You used to work for maintenance.
Yes.
So.
Yeah. We just kind of turn it.
She's another one I was gonna say.
Maybe she and I.
To be allowed to get to my person. Oh, but when I do like flowers.
Yeah.
We are now live.
Thank you, Ted. Just a mic check. Can you hear me in Zoom land?
Yes, loud and clear. Thank you.
Okay, great. We welcome back members and members of the public. We have a few folks kind of making their way to their seats, so we'll give it about 30 seconds. All right, and Ted, maybe just a quick tutorial on the mic situation. So those Mac. What? Oh, no, you can wait a second. I'll have a few housekeeping. Thank you, Lindy. From a mic perspective, just want to make sure, do folks around the table, are their mics always on? Do they need to be careful?
Yes, no, they are always on. And but if you sit back from the mic, we will not hear you.
Oh, him down there.
Thank you.
Okay. That sounds good. Okay, so MAC members at the table, just confirming your microphones are on. So just be cognizant of that. And I think at this point, Lindy, you are welcome to go ahead. We will get the Medicaid, the special MAC meeting kicked off. I'm going to take a look online and look at our participants. Okay, I want to recognize Terry Cole, our MAC co-chair is on. Hi, Terry.
Hello, sorry I couldn't be there in person.
That's totally okay. All right, so I'll get things kicked off. Today is a special meeting. It is what we call our annual post-award forum. And so I would like to, well, officially call the meeting to order and explain a little bit of logistics that are associated with this particular meeting. So a couple of things. First, our contract with the federal government requires us to annually provide a operational update on our 1115 demonstration waivers. Those are HIP, SUD, SMI. And so this is a meeting in which we share that information. it is a traditional public hearing where we provide a presentation. We have a court reporter here who then we ask for MAC member input. So you provide feedback if you're wishing to provide public comment on the record. So the court reporter will document that. It'll become a part of our annual submission that goes along with that 1115 waiver. And then we'll open it up to the public and ask for public comment that again will be sort of read into the record. And so this is really a public comment gathering forum. We use the MAC because it is a fabulous existing process and avenue where we have the technology, the process, the people. So we like to host our special post-award forum in the MAC setting. So these will happen, every year that we have an 1115. And let's see, so the format is we're going to run through a couple presentations. We'll open it up for MAC member comment. Our court reporter, his name is Lindy, and he will not be shy to let you know if you need to state your name, slow down, and he wants to make sure he captures your comments for the record. So just kind of pay attention there. And then the second kind of aspect I wanted to share and just touch really briefly. This is more of just a update to MAC members. I did share earlier this summer that after 8 years with FSSA and 6 years as Medicaid director, I do intend to step away at the end of the summer. Cora, I want to recognize Cora Steinmetz, who is sitting here with me. She is here today. She's the incoming Medicaid director, completely just floored and excited about that. We've been cross-training for some time now. That will continue through August 14th, when Cora will become the director, and I'll kind of sit alongside and provide support and transitional duties. So that means that the August 23rd MAC, Cora will be in this chair. I will be supporting. So we look forward to that. And so she's here today, really just kind of cross-training and getting a sense of how the MAC functions. So just wanted to share that. We do have a couple of other staff transitions within Medicaid that I wanted to touch on briefly, but again, at future MACs, we'll kind of dive in and you'll meet these members. I want to recognize Mary Riley, our medical director, and Frank Messina, our clinical ops director. They are both physicians and returning to practice. And so they have spent the last year and a half really helping us develop a culture and a team focused on clinical innovation and oversight. And they've done a tremendous job. We're very grateful for the work that they've done, really kind of pioneering and helping us develop. We do have a new clinical ops director. He's here today. He will get introduced through the natural kind of MAC cadence in future meetings, but Giovanni Bonilla is here, and he is again, we're into cross-training here in Medicaid, so he's working alongside Frank this week to cross-train, but he'll be the clinical ops director. You'll meet him in future meetings, but just kind of wanted to recognize some of those transitions. With that being said, we can kind of get to the meat of the presentation. I do need to take attendance for the court reporter. So I'm going to run through our MAC member list. If you could, as nimbly as possible, note your presence, that would be amazing. Maddie Augustus. Michael Baker. Is it okay if it gets in the Zoom chat? Would you be okay with that? Or if it's in the Zoom chat, if they put it in there, or do you want it verbal easier? All right, let's continue. Representative Brad Barrett. Cirilla Blackman. Sarah Boslett. Senator Breaux.
Present.
Senator Brown. Representative Campbell. Senator Charbonneau. I saw you on. Representative Clear.
Here.
Michael Colby. Terry Cole.
Excuse me, here.
Daniel Coulter.
Present.
Elizabeth Eichhorn.
I'm on the phone, Allison.
Thank you. I saw your chat. Thanks. Catherine Feely.
Present.
Deanna Ferguson. Representative Fleming. Zoe France.
On the Zoom, Allison.
Thank you. Heather
Yep,
Fretwell.
thank you.
Shane Hatchett. Herb Hunter. Representative Carrico.
Present.
Julia Kettner. Rodney King. Jason Kolkmeyer. Senator Lysing.
Here on the phone.
Thank you. Luke McNamee.
Here.
Gary Miller.
Present by phone.
Hello, Richard Nessel. Senator Kadora.
Present.
Evan Reinhardt. Dick Road.
Here.
Dan Rossiniak. And Robin Shackelford. Here. Excellent. Where's Robin? Okay, wonderful. Oh, wait, Shane Springer. Oh, just a few more. Fake out. Shane Springer. Katie Stafford Cunningham.
Present.
Jessa Turner Stultz. Kimberly Williams. And Senator Yoder.
Present.
Okay, excellent. And this is an optional, this is not a formal MAC meeting, so we do take attendance for the court reporter, but folks that aren't here, that's fine. It's not required. Again, we're just kind of leveraging the MAC space for this hearing, but appreciate those that did come. All right, so again, back to kind of the logistics of today. Our first update is on the Healthy Indiana Plan. We have Lynn Mong, who is our HIP and Hoosier Healthwise Director. She's going to provide an update that really kind of covers the last 12 months of operations. So she'll go through the presentation. When she is done, we will transition to the next. We'll kind of hit all the presentations, hitting a crescendo at the end where we then open it up for MAC member comment. If you want to provide written comment, the court reporter will take that, put it into the record. You're also, this goes to MAC members and the public, you're always welcome to submit comments, in writing to us directly. I know Lynn can provide her email address. Same with Andrew. So totally fine to do it that way, but I will hand it over to Lynn. Just waiting for okay, we are waiting for permission to share screen. So we're doing a little technology work. Ted, would you be able to help us let Lynn and then also Andrew be prepared for Andrew to share? They do have slides prepared for folks in the room and those on Zoom.
Screen share is now available. Thank you.
Thanks, Ted. All right, and if you look, oh, perfect. I was gonna say I can see your notes, but perfect. Thanks, Lynn. I have gone through an entire presentation showing my notes slide, so it happens.
Good morning. Thank you for joining us today. My name is Lynn Mong and I'm the
Oh, okay. Court reporter's having trouble hearing you, Lynn. So yeah, go ahead, bring that in okay, as much rock star as you can get.
Good morning. Thank you for joining today. My name is Lynn Mong and I am the Healthy Indiana Plan and Hoosier Healthwise Director for the Office of Medicaid Policy and Planning. And I've been with the Family and Social Services Administration since 2017. First with the Division of Family Resources, and then I came over to OMPP in November of 2021. And today I'm going to be presenting the annual update on the HIP program in accordance with the post-award forum requirement and the special terms and conditions of our waiver approval from CMS. Thank you. And then today, here's our agenda or the agenda for my presentation. I'm going to discuss HIP operations, including an overview of the program and eligibility. And I'll talk about our accomplishments since we met last year for this presentation. And we'll talk about federal reporting and I'll provide an enrollment update for the HIP program. And verbal comments can be made at the end of the meeting today after the presentations are over.
Thank you, Lynn. You're doing great. There is a request for you to slow down just a little.
I'm not in an auction. You can slow it down. I'm old. Thank you.
I'll try.
I asked her to do the same.
Okay, and just an overview of HIP in general for those of us who aren't familiar with every aspect of, the background of HIP. HIP operates under an 1115A Medicaid demonstration waiver that provides authority for Indiana to provide healthcare coverage for adults between the ages of 19 and 64 through a managed care health plan and a consumer-directed model. The current waiver approval gives Indiana the authority to operate HIP through December 31st of 2030. And Section 1115 of the Social Security Act gives the Secretary of Health and Human Services authority to approve experimental, pilot, or demonstration projects that are likely to assist in promoting the objectives of the Medicaid program. 1115 waivers give states flexibility to design and improve their Medicaid programs while allowing CMS to evaluate state-specific policy approaches to better serving Medicaid populations. And HIP aims to achieve the following objectives: improve health outcomes, promote primary and preventive care, foster personal responsibility and healthy lifestyles, assure the appropriate use of healthcare services, develop informed healthcare consumers by increasing health literacy and providing price and quality transparency, improve access to healthcare services, encourage quality, continuity, and appropriateness of medical care, and deliver coverage cost effectively. And as I mentioned earlier, HIP is delivered through managed care, which means beneficiaries are enrolled to receive services through one of 4 managed care entities under contract to the state. Managed care entities are also sometimes referred to as managed care organizations or health plans, but for the sake of brevity, I will refer to them as MCEs today. And the HIP members are given an opportunity to select an MCE at the time of application, and they have an opportunity to change their MCE each year during the annual open enrollment period from November 1st through December 15th. The state contracts with an enrollment broker to answer members' questions and assist with making an informed decision about their selection. And who is eligible for HIP? Indiana residents between 19 and 64 years of age who have income under 138% of the federal poverty level and who aren't yet eligible for Medicare or any other category of Medicaid. The eligibility population of HIP is primarily the expansion population, which is sometimes referred to as the newly eligible population. And both of those terms refer to adults who were not eligible for Medicaid prior to the Affordable Care Act, so low-income adults without disabilities or children. But other eligibility populations also fall into HIP categories, including low-income parent caretakers, pregnant individuals with under 138% of the federal poverty level income, the medically frail, and 19 and 20-year-old HIP members receive additional services through a federally mandated program called EPSDT, which stands for Early and Periodic Screening, Diagnosis, and Treatment. And this applies to Medicaid residents under the age of 21, but for HIP, we only have the only members who fall into that category are aged 19 and 20. And the state of Indiana calls this program Health Watch, and its purpose is to ensure access to comprehensive preventive visits so that health problems can be discovered and treated early. And what have we been working on since we talked last year? First, we'll talk about rate equalization. States have to follow federal guidelines in the administration of Medicaid. And one of those guidelines is that we do not direct one program to reimburse providers in a different manner than we direct them to reimburse other programs. The HIP program was being reimbursed differently than Hoosier HealthWise, Hoosier Care Connect, and Fee-for-Service. So Indiana applied for and received approval from CMS to continue doing so while we worked on our plan to come into compliance with federal guidelines. And as part of that approval, we have to meet certain milestones. If we miss any of the milestones as laid out by CMS, we could risk losing federal funding for all managed care programs. And so our multidisciplinary team has been working hard at making sure we meet every single one so that we can continue to best serve the Hoosiers that rely on us. And in the last year, they have drafted a plan for evaluating the effectiveness of the amendment, held public hearings, collected and summarized public comments to share with CMS and to inform the project team of the needs and concerns of stakeholders, and work with legislators to modify current state requirements to align with federal requirements and to pass a biennium budget inclusive of appropriation necessary to implement programmatic changes. And we've also drafted changes to managed care contracts and worked with contractors to establish a rate methodology and rate matrix to be applied across all managed care and fee-for-service programs. More changes we've worked on since last year, and these affect more than just the HIP program. The OMPP clinical operations team worked on implementing a prior authorization and utilization management hierarchy effective April 1st, 2023. For HIP, MCEs or their subcontractors are responsible for determining which services require prior authorization, processing prior authorization requests for their members, and notifying them about prior authorization decisions. This change makes it so that MCEs cannot have medical criteria or utilization management policies that are more restrictive than those described in Indiana Health Coverage Program policy. And for certain services, MCEs must follow Indiana Health Coverage Program policy exactly. And then next, effective July 1st, 2023, the pharmacy team worked to implement a statewide uniform preferred drug list, or SUPDL for short. And the SUPDL initiative is similar to those already implemented by surrounding state Medicaid programs. And the goal is to improve provider and member experience through enhanced and simplified medication access across all Indiana Medicaid prescription drug benefits without increasing overall prescription drug expenditures. And next up, we amended the HIP Basic Alternative Benefit Plan effective October 1st of 2022 to align with the statewide uniform preferred drug list. Previously, HIP Basic members could only receive a 30-day supply of medication at a time, and this change makes it so members may receive a 90-day supply, which is the same limit as those with coverage under the HIP Plus plan. And another amendment made to the alternative benefit plan is the clinical trial SPA, which went into effect the same day as the basic SPA. Previously, the clinical trials coverage was limited to clinical trials for cancer, but this change extends coverage for routine patient costs for items and services furnished in connection with participation by members in any qualifying clinical trial.
Excellent. Thank you, Lynn. I want to acknowledge Representative Fleming has joined. So for the attendance record, if you could say here, or am I good enough to vouch that she's here? Okay, great. And then if you could continue to slow down, that'd be amazing. No, that's okay, but thank you. Okay.
And the last milestone I want to talk about is the HIP and Hoosier Healthwise MCE Readiness Review. Readiness Review is a large-scale review of MCE staffing, policies and procedures, processes, documents, member and provider communication, subcontracts, system capabilities, and provider networks to ensure they are prepared in advance of the new contract go live. The overall planning and execution of Readiness Review took over a year, and from April 2022 through December 2022, 540 requirements were evaluated and 7,474 documents were reviewed as the 4 incumbent MCEs demonstrated their capability to execute their contracts to OMPP. Anthem, CareSource, MHS, and MDYs are the incumbent HIP MCEs, and they are all returning from the previous contract. And now we're up to the HIP enrollment update. And so I thought it would be helpful to give a high-level overview of our federal reporting requirements for HIP. Last year, we had a lot of results from the 2018 to 2022 HIP summative evaluation to discuss. But because we have demonstrated to CMS that HIP is working, we received a much longer waiver approval period at the last renewal, and our independent evaluations are spread throughout that 10-year approval period. Independent evaluations are required as a condition of 1113 waiver approvals. The OMPP federal reporting team works with an independent evaluator to make sure necessary data is collected to research the approved hypotheses. An evaluation design is developed and goes through the CMS submission and approval process. And then drafts of the required reports are submitted to CMS as they come due, are revised as needed, and posted on the state's Medicaid website for public access. Currently, the federal reporting team is working with our independent evaluators on the 2021 to 2023 interim evaluation report, which is due at the end of 2024. For quarterly and annual monitoring reports, the federal reporting team develops a monitoring protocol that describes the data collection and reporting and analytic methodologies for performance measures identified by the state and CMS for inclusion in those reports. And this is the report in which we'll summarize all of the comments from today for submission to CMS. The next time we submit that report, that's when CMS will get all of these comments from today. In this graph, we show HIP enrollment data over the last 12 months. Enrollment continued to grow from July 2022 through April of 2023. When the return to normal process started, as anticipated, we're starting to see reflected in the enrollment counts of our most recent months. So pre-pandemic enrollment counts in the first months of 2020 prior to the public health emergency were around 400,000 members. And you can see that as of June 30th, we still had 789,556 members enrolled in HIP, which is nearly double the pre-pandemic count. And I thought it would be helpful or interesting to be able to visualize the number of Hoosiers benefiting from HIP enrollment. So this chart shows HIP enrollment in comparison to the population of Indiana as a whole, and in comparison to enrollment in all Indiana Medicaid programs. And based on US Census data in 2020, HIP members made up approximately 33.4% of Indiana Medicaid enrollees and 8.6% of the population as a whole. In 2021, approximately 35.4% of Indiana Medicaid enrollees were HIP members, and 10.2% of the population of Indiana was enrolled in HIP. In 2022, those numbers increased again. 36.2% of Indiana Medicaid enrollees were HIP members, and 11.5% of the population of Indiana was enrolled in HIP. And as of June 30th, those percentages from 2022 have held firm, though they're still exactly the same. And this snapshot of enrollment eligibility is as of July 18th, 2023. This graph does not contain our members who are in the MAMA category, which is for our pregnant members, pregnant and postpartum members, because they cannot be disenrolled for any reason during pregnancy or the 12-month postpartum period, regardless of income. But approximately 82.4% of our HIP members are at or below 100% of the federal poverty level. And despite the significant increase in enrollment since 2020, the percentage of members at or below 100% of the federal poverty level remains nearly the same. And this slide talks about preventive care utilization. That is one of the metrics included as part of our quarterly and annual monitoring reports for CMS. The state provides all HIP members with incentives to receive preventive care services. And members have not paid power account contributions during the public health emergency. And almost all members have been enrolled in HIP Plus, but the program is designed such that if members receive a preventive care service during the calendar year, the state will either match the member rollover amount, which can be applied to next year's PAC requirement, or if the member is in HIP Basic and not subject to power account contributions, they can earn a discount on PAC amounts if they choose to switch to HIP Plus during the next benefit year. And that is it for my presentation today. This is my contact information. If you'd like to submit any comments in writing, you can submit them to my email address or via mail. And I will pause here in case anyone wants to make a note of those.
Excellent. Thank you, Lynn. Appreciate it. So that wraps up our post-award forum annual report on HIP. Just reflecting that there was a lot of policy and program development that Lynn featured. We're in the period of a 10-year renewal. HIP rates at Medicare, the single PDL, PAUM, all really, I think, nice enhancements to HIP that have those pieces will be featured in an upcoming MACs. We'll go into the different programmatic details. We've actually featured some of those in prior MACs. We will revisit. So if there are aspects of the presentation that were of interest, please connect with us and we'll hit those on future meetings. We will take public, both MAC comment for the court reporter and public after we get through our next presentation, which is on our next set of 11:15s. Andrew, I'll let you take it away.
Okay.
Thanks again, Lynn. Appreciate it.
Good morning, MAC members and members of the public. My name is Andrew Sakaris. I am a policy developer here at the coverage with the Coverage and Benefits Unit at the Office of Medicaid Policy and Planning. So a little bit of background of myself. I have been now working for the state for about 1 year, and before that, I received my master's in social work. Today we are going to be talking about the annual update for the 11:15 demonstration for the SUD and SMI waivers. So I'll be providing all the information for the demonstration information of the year of 2022. So to begin with, what do I mean by a waiver? The SUD SMI waivers are Section 1115 demonstration programs. Section 1115 of the Social Security Act gives the Secretary of Health and Human Services authority to approve experimental, pilot, or demonstration projects. These demonstrations give states flexibility to design and improve their programs, but also require rigorous data collection and evaluation. Demonstrations must also be budget neutral to the federal government. So why did Indiana Medicaid pursue these waivers in the first place? This is to bypass the IMD exclusion. So what is the IMD exclusion? The IMD exclusion is a discriminatory federal rule that prohibits Medicaid reimbursement to states for adult patients receiving mental health or substance abuse care in a psychiatric or substance abuse treatment facility with more than 16 beds. Another term for these types of facilities are the institutions of mental disease, the IMD. And within this slide, I have also provided the CFR that talks about the definition of the institution of mental disease. So with this waiver, we are actually allowing our members to seek care in these type of facilities, which is actually a benefit. So this is the agenda which I'll be going over today. The 2022 accomplishments. First, I'll be going over the SUD waiver overview, the goals, the milestones, monitoring report metrics, and then I will be doing the same, but for the SMI. To give some clarification, SUD, every time I refer to SUD, is substance use disorder, and SMI is serious mental illness. And for children under the age of 18, there's the term of SED, which is seriously emotionally disturbed. So these are my three takeaways that I want the MAC members and the members of the public to take away from my presentation. There has been a continued increase of Hoosiers being diagnosed with a substance use disorder or SUD from 2021 to 2022. However, more Hoosiers who have been diagnosed with a substance use disorder are being treated in residential facilities and participate in medicated assisted treatment or MAT. And also increases in the usage of telehealth and stays in residential facilities for individuals with a serious mental illness or a serious emotional disturbance, and SED, has led to decreases in emergency department stays. So 2022, the year in review. So these are some of the accomplishments that we have had. First of all, certifying behavioral diagnoses. So before 2022 and this rule change, the only individuals that were allowed under our policies to provide behavioral health diagnoses were physicians, physician assistants, and also HSPPs, which is a health service provider in psychology, I believe. So this allows, so what we did is we allowed to certify behavioral health diagnoses for the following individuals: a licensed clinical social worker in LCSW, a licensed marriage and family therapist in LMFT, a licensed mental health counselor in LMHC, and a licensed clinical addiction counselor in LCAC are now able to certify a mental health diagnosis within a patient's treatment plan. And also this provides greater access to care for these individuals. Next, the telehealth code set development. We are continuing to allow and expand more services that can be rendered through telehealth. What we have found through the pandemic to now is that telehealth has been providing a lot of access to care for not only individuals who may have difficulties with transportation, but also individuals who are living in rural communities. So these services are providing more access to care for them. The next one is the opioid treatment program weekly bundles. And this has been actually this has been effective since July 1st of this year. So the Division of Mental Health and Addiction, DMHA, and the Office of Medicaid Policy and Planning, OMPP, collaborated to align the Medicaid services closer to Medicare. So before July 1st of 2023, we had a per diem rate that would be allowed for weekly bundles that would allow members to have access to services just like for example, methadone, buprenorphine, and naloxone. With the changes now, these are now weekly bundles. These are actually going to allow more access to care for our members, but also reduce some of the administrative burden that our providers have to go through. So this is actually a really good thing. And a lot of our guidance from this is coming through CMS. And then the last one, the Crisis Intervention Services Overhaul. DMHA and OMPP collaborated to bring more access for mental health services by planning and implementing mobile crisis intervention units. And I have some good news on this. We have actually implemented this service in July 1st of 2023. This is actually to be aligned with our 988 service. So this allows members in the community, instead of calling 911, you can call 988, and a team of certified individuals through DMHA will come out and help you in the community and provide you services there. So this is actually a really good service that we just started in July 1st of this year. So with the Indiana SUD waiver, so what is the Indiana SUD waiver? Indiana's substance use disorder SUD waiver allows the state to receive federal financial participation, FFP, for short-term inpatient and residential stays for individuals aged 21 to 64 in qualified facilities that are considered institutions for mental disease, IMDs, under federal law. State commits to making continued progress towards a variety of waiver goals and milestones for the duration of waiver approval. The waiver requires robust federal monitoring and evaluation requirements to measure the success of the waiver implementation. And if you look at the side, we did originally apply for this waiver in February 1st of 2018. And then we were approved for this in October 26th of 2020. And right now we are now in the midpoint. So this waiver is going to be until the December 31st, 2025, and we may apply for a renewal of this waiver. So so what is the general criteria for qualifying IMDs for the substance use disorder? A facility will be recognized as a qualifying IMD under the SUD waiver if it meets the following requirements. Inpatient SUD, enrolled as a psychiatric hospital, provider type 01 and a provider specialty 011 with more than 16 beds. Just a point of clarification, provider types and provider specialties are what we enroll them under Medicaid as. So if you ever hear provider type and provider specialty, this is what we were referring to as how they are enrolled under Medicaid. Residential SUD, enrolled as a SUD residential addiction treatment facility, provider type 11, behavioral health provider, and provider specialty 836, SUD residential addiction treatment facility. So this has some more requirements. The SUD facility must receive DMHA designation indicating approval to offer ASAM level 3.1 or 3.5 residential services. I will explain ASAM in a further slide down the presentation. Facilities that have designations to offer both ASAM 3.1 and 3.5 services within the facility must include proof of both with their enrollment application. And they also must be certified as a residential, or sometimes it's called a subacute stabilization for DMHA. Note, state-operated facilities, SOFs, are currently ineligible. So these are some of the waiver goals that we have for the SUD. One, to expand the availability of SUD services and providers. So this is to increase rates of identification, initiation, and engagement in treatment, reduce utilization of emergency departments and inpatient settings, and reduce overdose deaths. Increase utilization of evidence-based treatment methods, so fewer readmissions to the same or higher level of care when the readmission is preventable or medically inappropriate. Improve access to care for physical health conditions among beneficiaries. Improve care coordination and transitions of care. Administrative improvement and simplification, increase provider networks and participation, assure accuracy, consistency with better provider education and guidance. So next, this is for the SUD residential growth for ASAM 3.1 and 3.5 facility beds. So ASAM, which is the American Society of Addiction Medicine, established treatment criteria for addictive, substance-related, and co-occurring conditions. Within this criteria, individuals are assessed for their level of care at their intake. ASAM 3.1 are low-intensity residential services. ASAM 3.5 are high-intensity residential services. So if we look here, these are our current figures of how many beds we currently do have in Indiana, compared from 2022 of June to now 2023. So in June of 2022, we had a total of 68 total facilities with a number of beds of 2,509. Right now in July, we have 80 facilities, and those are now with our total beds of 2,953 beds. Of the 3.1 and 3.5, for 3.5 level, we have 15 facilities that offer the service and 274 beds. For ASAM 3.5, we have 62 facilities and 2,554 beds. And a combination of 3.1 and 3.5 are only 3 facilities and 3 beds. For 3.1 and 3.5, this is a rather new thing that we are now seeing more and more providers are willing to do. So these are the Medicaid members with a new SUD diagnosis. If we look at this chart, we can see the top line, that is 2022. We are seeing an increase of Hoosiers who are recognized as having an increase of an SUD diagnosis. This is around 25,000 Hoosiers. Comparatively, if we look at 2019, it has been much lowered. So this is a trend that we are looking at, we are quite concerned with. However, continuing, total Medicaid members with an SUD diagnosis. Right now, currently in 2022, 2,158 members are currently having a substance use disorder diagnosis. Compared to when we look at 2020 and 2021, this has been an increase of 80,000 members. However, here's some good news. Medicaid members treated in an IMD for an SUD, what this waiver allows us to do. We have seen an increase of the members being treated in an IMD, which is actually a very good thing. Individuals are being met and they are being treated for the help that they require. So this is a very good thing that we are seeing. Furthermore, number of members utilizing MAT for SUD. So once again, MAT is medicated assisted treatment. This goes along with, for example, methadone, naloxone, and buprenorphine. And we're seeing more and more members utilizing these life-saving drugs that could help them to along their opioid recovery process. So more and more Hoosiers from 2019 to 2022 are utilizing these life-saving services. Furthermore, the emergency utilization for SUD per 1,000 Medicaid members. If we look here, 2019 is the top line. These are the members who are going to the ER for assistance. However, if we look at 2022, it is actually the bottom one. So what we are seeing more and more less members with an SUD going to an emergency room within 4 years. This is actually a very good thing, because what we have noticed is when members are going to an emergency room, this is probably one of the most traumatic things that they can go through. So we are allowing these interventions such as residential facilities and also MET services to meet members where they are. So instead of going to the emergency room, they are utilizing different treatments that are utilizing for their needs. So this is a great thing. Okay. Rates of readmissions among members. So we are seeing a slight increase of the rate of readmissions among members with an SUD. This is quite concerning to us, but this is also along with, we are seeing the increases of SUD diagnoses, and also we're seeing the impacts of what the opioid crisis has been doing to Hoosiers. So this is something that we are concerned with. So now I'll be talking about the Indiana SMI waiver. So Indiana's serious mental health, mental illness SMI waiver allows the state to receive federal financial participation FFP for short-term inpatient stays with individuals with serious mental illness aged 21 to 64 in qualified facilities that are considered institutions for mental disease, IMDs, under federal law. This waiver, along with the SUD waiver, also requires robust federal monitoring and evaluation requirements to measure the success of waiver implementation. And these are the dates in which we did apply and got approved for this waiver. So the Indiana SMI waiver. So a facility will be recognized as a qualifying IMD under the SMI waiver if it meets the following requirements: enrolled as a psychiatric hospital, provider type 1 and provider specialty 011 with more than 16 beds, certified by the Division of Mental Health and Addiction, DMHA, as a private mental health institution, a PMHI, and currently state-operated facilities, SOFs, are currently ineligible under the SMI waiver. So these are some of the goals for the SMI waivers: to reduce the utilization and length of stay in emergency departments, reduce preventable readmissions to acute care hospitals and residential settings, improve availability of crisis stabilization services, improve access to community-based services, and improve care coordination and continuing of care in the community post-discharge. So let's take a look at first the emergency department utilization. So what we are seeing here is that in 2021, we saw a high number of individuals with an SMI utilizing the ER at the hospital. However, right now we are actually seeing a decrease of individuals utilizing the ERs. And actually, surprisingly enough, this is at the same level of what we were seeing in 2020. Telehealth utilization. So how many members are utilizing telehealth for SMIs? This is actually a very big thing with our expansion of the telehealth code, things as this provides a great option. As you can tell, 2020 is going to be the highest number because of the pandemic. This is what we all expected. But right now, 2021 and 2022 are now being decreased because more and more people are seeking services that are in person. Members are still allowed to have telehealth services if they would want, but also now we are allowing more and more in-person treatment. So any SMI service utilization. So how many people are utilizing services for serious mental illness? These are actually in trend with the years that we have been seeing. More and more people with serious mental illnesses in Indiana are seeking the help that they need. So this is actually a good thing. We're trying to meet people where they are at when it comes to these specific populations. And with the IMD utilizations, We are seeing an increase of members going to residential treatment facilities that have been allowed under this SMI waiver to get the help that they need. So this is actually a very good thing that we are seeing. So the conclusion and the three takeaways. So once again, these are the three takeaways that I have showed at the beginning of the presentation. Yes, there has been a continued increase of Hoosiers being diagnosed with a substance use disorder from 21 to 2022. This is unfortunately has been expected, unfortunately, but more Hoosiers who have been diagnosed with a substance use disorder are now being treated in more residential facilities and participate in medicated assisted treatment, and also increases in the usage of telehealth and stays in residential facilities for individuals with a serious mental illness and serious emotional disturbances and SED have led to decreases in emergency department stays. And we have shown this through the data that I have provided in this presentation.
Excellent. Thank you, Andrew. Really appreciate that. So as you can see, and as MAC members and members of the public can see, with an 1115 waiver, specific terms with the federal government are, hey, you're going to evaluate how these policies are impacting. And so in this report to CMS that we do annually, you heard from Lynn and Andrew, different utilization points, trends that we're tracking. And those are items that are going to go in the annual reports, along with public comments that we will take here in just a moment. Those will go along with the record because we are, really looking to see improved outcomes, increased access, which we are seeing with both waivers. And maybe just a quick comment, we are a bit forward in Indiana in that we were the first major 1115 to get approved for 10 years. So that was HIP. And Andrew mentioned that our SUD and SMI, we were approved at 5 years, which is the new top max for those. Typically, they've been 3. And so we're really at a nice sustainability point as well. A lot of evaluation goes into these 1115s, and having that 5-year and 10-year runway gives us time to do some meaningful and sustainable policy and program enhancement. So now we'll go to the point of public comment. MAC members, you're up first. So if you would like to provide public comment, please, let the court reporter know your name. He'll take your public comment. If there are questions or kind of policy issues that have come up, please save those. We have an August and MAC. We have an August, reverse it. We have a MAC in August. And so we will absolutely revisit a HIP, SUD, and SMI are topics that we revisit often, so we can have a discussion, dig into the data. At that point, this is just an opportunity to receive public comment for the record. So just want to provide that kind of clarification. So MAC members, does anyone have any public comment? We'll go in the room first just to see.
Do you want the questions I texted you, or can we plan on those being offered at the next meeting?
Yeah, yes. If you have any questions, send them to myself. You can email, text them.
Okay.
We will address those in an upcoming meeting for sure. If there's something in there that you'd like to add to that public document, please. Okay, any MAC members on Zoom? Oh, Senator Yoder.
Thank you. Sorry, I had to leave.
That's
have
okay.
a question about the SUD and the 1115 waiver. Is that bound by income level and not the same as the maternity HIP, where if you're pregnant, you never are ineligible? Can you tell us if SUD has an income eligibility requirement?
Thank you, Senator. So we are, yes, there are income eligibility limits. We will definitely address those in an upcoming MAC. I think for the purposes of this meeting, we are just taking public comment to put into the written record to submit to CMS. So if it's okay with you, would love to flag your question. We'll make sure it is in a follow-up MAC, and we can also, we don't have to wait till August. We can send you answers, certainly, just, through email or a phone call. But thank you for the question. We'll take it back.
Well, Allison, I guess if, this is Senator Bro,
Hey, Senator.
and if I'm making a comment, I do have questions from both, the presentations, but I'll
Yeah.
ask those offline.
Perfect. Yes, please
Um,
keep them.
But
'cause
if
they will
I
inform our
make a
agenda.
comment, I guess I'm glad that Indiana has HIP and that we have been approved for 10 years, which is, according to your, just your previous statement, not something that happens in all states. I still am concerned about that power account. And I have asked that some folks who are taking a look at just the feasibility of what it cost us to administer that program versus just allowing folks to have access to healthcare benefits without the additional administrative burden. And just what does that cost the state? And what does that cost the person? What does it cost the state in turn? And what does it cost the individuals who are the beneficiaries of the HIP program? So that's always still something that's a concern that I think that we really need to look at the feasibility of that.
Yes. Thank you so much. That will fit nicely into the written record. And I recognize that there are actual questions in there as well. And we will make sure we incorporate those and connect with you and then also use the Max space to work through that. So thank you.
Well, I'm just putting that on the record.
Yeah,
That whole.
absolutely. We got it. Linda, you got it, right? Okay. Any other MAC members before we go to public comment? Representative Clear.
Thank you, Representative Ed Clear. I have a number of questions that we can take up at a later date. But I was trying to think of what I might want to put on the record, specifically with respect to the 1115 waiver for HIP 2.0. I'm glad that we have the long-term approval for HIP, but recognizing that it started out as a demonstration waiver, and I guess technically still is a demonstration waiver. I hope there's an ongoing effort to demonstrate, to innovate, and I think at some point there needs to be a conversation about revisiting the codification of HIP 2.0. As I recall, that was in 2016. I think it was Senate Enrolled Act 165, if my memory is correct. I think it was 2016. I'm sure I have the bill number right. I don't know about the year, but I think it was 2016. But I expressed concern at that time about codifying HIP 2.0 and possibly losing the ability to modify it as conditions changed or to experiment with new innovations. And I think one example we're seeing right now with respect to the downside of codification is the disenrollment coming out of the public health emergency, and the restrictions around the ability to provide retroactive coverage. I think there may be some ambiguity about regarding what the secretary can do in the context of the codification, because I don't think retroactive coverage, as I've thought about this, I don't think it would go against the financial contribution requirements that are codified. I don't have the language in front of me, but so I think there may be some flexibility there. There's probably some ambiguity there, if nothing else, but that's just an example. And again, recognizing that HIP 2.0 is an innovative and very successful program that has resulted in coverage and access for hundreds of thousands of Hoosiers. I hope the administration and the legislature will at some point have a conversation about revisiting the codification and making sure that we have the ability to continue to innovate and to continue to meet the needs of Hoosiers. Thank you.
Thank you for your comment. I appreciate that. At this point, I think.
Allison, this is Zoe from Zoom for comment with Matt.
Oh,
Can I raised my hand. Can I share? Is that okay?
yes, let me change my view too, so I can do a better job of recognizing you all. But yes, please.
Okay, two things I wanted to share.
Zoe,
First,
go ahead and state your name. Sorry, Zoe, to
okay.
jump in for the court reporter.
Okay.
State your name. And Zoe
Yeah.
is a MAC member, so we are still in MAC member comment period. Go ahead, Zoe.
So Zoe Freehan, CEO and President of the Indiana Council of Community Mental Health Centers. And the comments I would like reflected regarding both the HIP and the SMI waiver has to do around workforce. And we have seen a correlation in the improvements that have been made with telehealth and the ability of professionals to diagnose of our system's turnover going down. While we still have work to do, we have seen that telehealth has helped in retaining workforce. And I think as we talk about access, we cannot lose sight of the impact of workforce and what that waiver and the support has done through your great efforts there at Medicaid. So I would like to state workforce. And then also, Andrew mentioned this and did a phenomenal job in his presentation regarding the success, but the emergency room rates going down, I think spelling out the overall cost savings of that emergency rate going down to the state of Indiana, with that being the most costly point of service, and showing the impact of what community mental health centers, residential providers, and others have done on less cost, I think it's important to continue to show that support of the waiver, both with HIP and the SUD SMI.
Excellent feedback. Got that in the record. I've also made a note.
Great.
Any other MAC members in Zoom? Feel free to, I can see you now. So if you put your hand up, should be able to get you. And of course, you are welcome to submit written comment to us as well. We'll receive that and put it in the record. All right, I don't see any hands going up in our MAC meeting space. I will pivot to public comment. I think I've got a written paper. Okay. So no one is signed in on the paper sign in here in the room. I'm going to look to the chat to see, I know we have team members monitoring the YouTube channel, see if there are any comments coming in that way. We can receive them through the Zoom. I'm happy to read them, provide them to the court reporter. We may be able to move you to the Zoom room as well, provide you a link. But I'm going to pause just for a couple of awkward seconds because I imagine it'll take a minute. I'll also look at my phone. I'm sorry, to those in the Zoom room, I've got team members here, so who are I'm going to step away from the microphone. I am still here. Okay. I think we're retrieving a public comment, so bear with us. Okay, so we have 3 from a public commenter. Are they? Okay, perfect. They're gonna be, okay, great. All right. Hi, Tracy Hutchins. Gets. So I've got a written comment. I'll read it into the record from Tracy. She says, thank you, Senator Bro. Hoosier Action leaders share your concern with administrative costs associated with power accounts. Also, thank you, Zoe France. It's critical that we support Medicaid providers as well as members. Okay. Thank you, Tracy. Really appreciate it.
Who was that, Tracy?
Tracy Hutchings gets, Hoosier Action Coalition.
Allison, this is Terry. Just real quick,
Terry.
she also thanked Representative Claire and shared support for HIT 2.0 and agreed that we should revisit the codification.
Excellent.
Yeah, just wanted to make sure you saw that. Yep.
Excellent. Okay. Any other public comments? Again, do not hesitate to shoot us emails with the public comments that you have. We'll get them into the record. And let's confirm next steps. So our next regular meeting is August 23rd at 10. It'll be a hybrid format. At that point, Cora will be Medicaid director. I will still be on staff and providing support. So we will kind of coordinate and look forward to kind of getting back to regular program updates on Medicaid activities. Terry, thank you for your participation and co-captaining today. I think that's it without additional public comments. Court reporter, thank you for your time. I think we can officially close the meeting and the public hearing, the post-award forum on our HIP, SUD, and SMI waivers. Lynn and Andrew, thank you for presenting. It is, these waivers are very comprehensive. Yeah, absolutely. So email comments can go to, actually, Lynn and Andrew, don't mean to put you on the spot. Can you each read your emails for HIP? Please, Lynn, go ahead.
So my email address is lynn.mong, that's spelled LYNNE.MONG @fssa.in.gov.
Excellent. Andrew.
Okay, my email address is andrew.sekeres. That's ANDREW.SEKERES @fssa.in.gov.
Thank you, Andrew. I think that'll do it. So those are the 2 places. And then certainly you can engage with our MAC committee website. I think we have contact information there if you're ever sort of at a loss in terms of who to contact. So again, thank you. I was going to say those are very comprehensive and significant programs within Medicaid, and I appreciate you covering a lot of ground in a brief amount of time. I would be remiss if I didn't say, it's been such an honor to chair the MAC. I was actually on the MAC as on the other side before coming to Indiana Medicaid. So really committed to Medicaid and improving the system for Hoosiers. And it's been such an honor, and I really appreciate you all, and we will sign off and see you August 23rd. Thank you.
Thank you, Allison, for your service. We appreciate you.
Thank you, Senator.
Thank you.
Yeah, thanks for
So
attending.
I do have some questions, Andrew, but I'll text it to you, and I have some for you as well. I'll text them to you.